Acceptance is the foundation to stuttering management. It is just the beginning. Management is about what comes next. The child's feelings play a huge role in stuttering. Feelings can be as much part of the disorder of stuttering as the child's speech. Stuttering and feelings tend to play off of each other. For example, if the child is excited or frustrated, this can lead to repetitive stutters. If stutters become more consistent, this can lead to frustration. Children this age are becoming more active in school. They are getting involved in activities and clubs, reading out loud in class, and starting to interact more in the classroom. Fear of stuttering again, frustration, guilt, and shame are a few of the emotions that your child may experience during these encounters. As a parent or guardian, you too experience negative feelings such as grief, anger, guilt, frustration, and sometimes feeling hopeless. These are considered to be normal feelings, and all parents at some point experience these emotions. It is very hard to watch someone we care about having difficulty. It is important to have continuous open discussions with your child about their stuttering. This will help them to accept that they do stutter and that it's okay. It also helps to raise awareness and can make them feel more comfortable as time passes. Showing support and creating a positive environment is beneficial for your child. Having your child accept and free themselves from shame, anxiety, anger, frustration, and fear gives them the freedom to say what they want to say. Typically, adults and adolescents who stutter have many negative attitudes towards themselves that have developed throughout the years. Listeners play a huge role when it comes to dealing with your child's attitude that they have of themselves. As a parent and guardian, you have the responsibility of being a good listener. Later, we will discuss tips on how to be a good listener. Intermediate age children are beginning to start transitioning into adolescence and middle school. It is important to help guide and build up their self-confidence before they make this transition so that they can work to maintain a positive attitude about themselves. As a parent or guardian, your role is to advocate for your child as much as possible to help them be successful. This picture shows you a brief activity you can do with your child. This allows you as a family to discuss both feelings and attitudes concerning the child's stuttering. The top of the iceberg shows what people can see. The bottom of the iceberg shows what is hidden from others and oneself. This is a good activity that can be modified and individualized for your child. It can be used to address stuttering as a whole, or it can be used for a specific situation.
During intermediate stuttering, there is an increased amount of tense blocks, repetitions, and prolongations. There is also an increased presence of fear and anticipation of bad experiences. Feelings of embarrassment, shame, and guilt can increase as well because they realize their speech is different than that of their peers. It is important to monitor and understand your child's feelings and emotions. Ways that you can help to do this are: be aware of your child's worry and discomfort. Emotions and feelings are a large and very important aspect of disfluency. As seen in the iceberg activity, emotions are not always seen, but they are always present. It's important to remember that parents' behaviors are never the cause of stuttering. You, the parents, are the nearest and best supporters on your child's road to talking more easily. By allowing your child to speak openly about their disfluency, you are enabling them to be able to feel more comfortable. What children need most are parents that allow them to express their opinions about their stuttering and who show they understand. Children often feel that they need your unspoken permission to express their feelings. Make sure your child feels free to take up the subject if they are ready to do so.
Don't finish his or her sentences. Children who stutter know what they want to say and generally do not like it when their sentences are completed for them. It elevates their stress levels, possibly increasing incidences of stuttering. Wait patiently for your child to finish. Don't rush your child who stutters, and provide adequate wait time for him or her to complete the thought. Watch your body language because children are very aware of your nonverbal reactions to their speech. Keep your face neutral with an unchanged expression when your child stutters. Your child has learned many speech tools in therapy. When approaching your child about using their speech tools in day-to-day life, it's important to first consult their speech-language pathologist. All children learn differently and adapt their speech tools in different ways. It is important to support your child in their use of their speech tools, but not to put pressure because increased stress could cause increased disfluency. Out of the tips discussed, the most important tip is being open for your child to discuss their disfluency. It is a large component in helping your child regulate their feelings and emotions. This enables you to become a safe harbor for your child because they know that you accept them.